Okay, so we are going to be working on videos. I've actually never done this presentation before. We work with cats all the time, and we had a lot of videos, and I was like, well, let's see what happens. The point of doing this particular video-heavy presentation is not necessarily as much about a show and tell, although that's definitely a part of this. It's also going to be a part of what do you see? What are some other things that we might want to do for these cases that maybe we haven't done yet or we didn't think to do at the time? So your input is actually going to be really helpful for me because a couple of these cases are still very much active cases and we're still working on them. So this is going to be more of a back and forth dialogue, which means we may start and stop some of the videos. I may replay a couple of them, we'll just kind of wing it as we go along. I will also add that if you have any additional questions or comments about any of the material that we do go through, because this is the first time that I'm going through this way, I'm very, very much open to feedback. So if you've got anything to share with me afterwards, please feel free to do so. With that being said, I'm going to start out, and these are really in no particular order. I'm not looking at this as any sort of progression. They're just individual cases showing different applications for various forms of behavior mod. So I'm going to start, this is a clip from Dr. Sophia Yin, and I know that there's a lot of push right now, both in terms of the whole fear-free movement as well as low-stress handling and cooperative veterinary care and all of these different elements that we're working on. And yet I also know that there's a lot of questions for people about, but what does that actually look like? What do we do with that? Like, I'm totally behind it in principle, I'm there, I'm ready, I'm supportive, but what do I do? So for those of you who are working with cats, this is one example of where we can get started. So what I want to show you on this one, and I'm going to start and stop this a couple of times, this is Dr. Yin working with a kitten, obviously, who's a little freaked out by the camera. But not by the handling, right? So this is a kitten who's already been reinforced for sitting, is comfortable with the process. And what I want to start and stop on this one, so this is a process of creating foundation skills for later pill administration. And I know that at least one of you asked about this particular thing earlier. And so what I'm wondering, as we're looking at this, is what are the pitfalls, what are the advantages of doing this as a kitten? Now, I would say as a veterinarian, when I was working with kittens routinely as part of veterinary care, this is something that we would literally be doing in the process of talking with the owner and basically about telling them how cute their kitten was. Is that I'm already in the process of basically, so let's say if I were working with this kitten, I would be on that opposite side of the table if the client were here, and if the kitten was tolerating that, I might have even just kind of gently manipulated that cat if it hadn't learned how to sit already, kind of manipulating it into a sit position or into that position in front of me. And then I would just, as I'm just massaging and getting underneath those chins, then it'd be a little bit of a pause. If I'm using any sort of a mark, it might just be, oh, I think you're such a cute little kitten. Food. And so I'm just getting in the process of just creating these little micro pauses of restraint, then a little bit more head elevation, then I might do a head elevation with a little bit of a hold over the top, reinforce, and just getting into that verbal mark training in the process of doing what else I'm doing. Now, when it comes to this particular procedure, what I want to be very, very clear on is as we get the positioning right there, I never stop it precisely at that moment. This is perfect. Yes. When you're going to actually restrain that animal, so all she's doing here is basically getting that little bit of a baseball hold over the top. This is not a grip of death. It is not that. It's really just supporting along the jawline, getting a little bit of a tip backwards, and as she's using the right hand in this case to manipulate the mouth open, and then she's depositing a little bit of tuna. So basically just creating this conditioned thing that yes, there's going to be a little bit of restraint, but guess what happens? It's amazing. I'm putting the food directly in your mouth. How much more amazing could this be, right? Now, from a positioning standpoint, what I want to stress is that if you are coaching clients on this, or if you're doing it yourself, if this isn't something you've done a lot of already, I want you to be intensely aware of your hand placement, especially as it relates to positioning on the face and the whiskers. If you come in and basically just sort of grab from the top and you're kind of scrunching the whiskers laterally, that is one of the fastest ways to create an aversive response for the kitten for this procedure. Kitten, adult cat, I don't really care which we're talking about. It's going to be the same thing. We can create that aversive response just like that. On the other hand, if you were to, come in for this positioning, I'll see if I can do this here, and come in just a little bit forward, and then kind of coming back into position, you're more likely to get a little bit more of an appropriate placement without scrunching laterally. So that is something that for veterinary technicians, for example, who are really good at pilling cats, it's something they're already doing naturally, but if they're not including it as part of the education process to the owners, we're actually setting the owners up to have a greater failure rate, because not only are they missing a really important part, but then there's also that comparison game. Well, the tech could do it, but I can't. So now I'm really dependent on the tech or the doctor or someone else to be able to do this procedure. So hand placement as well as the timing of the reinforcer is really, really helpful. So in this case, just that little bit of an opening, deposit food, go away. And then in between reps, checking the body language. Is this patient still engaged in the process? Yep. Ears are forward, hasn't made any sort of avoidance behavior, hasn't shown any motivation to move away, so we can keep going. We can do a couple more reps. Doesn't always go exactly the way you want it to. And we're able to work through that process. Do you have any questions for me on this particular procedure?
Is she marking?
Is she marking? She's actually not in this case. It's really more of a, yes, it's operant in that there's a physical requirement to it, but she's not marking or doing anything like that in this particular case. Yeah, I personally would. I think it adds an additional level to the exercise. But I also find that for clients who are doing this for the first time, adding in the mark, even if we're doing a verbal mark, is sort of like, kind of patting your head and rubbing your belly at the same time. It's like, okay, kind of 1, 2, there we go. It's that coordinated effort. And so depending on the skill level of the client, I may be coaching them on using the marker or not. And we'll see that in a couple of the other exercises as well.
So when you want to mark, is it at the point that you're holding the jaw or opening the mouth? Like, which of these are you marking?
Great question.
I've done this in front of clients and I've shown them.
Yes.
Little fancy piece treats are fabulous if you can't like open a whole can of tuna food. So I've used that and the kittens have been like, oh wait, that was the best, but I've never marked it.
Yeah, so for me, and that's a great question of any sort of a progressive sequence, or if there's, so I'm going to answer this in kind of a roundabout sort of a way. If we're doing an exercise like this, I'm not necessarily going into the exercise with the expectation, at least the way I do it, of doing the full sequence the very first time. So in some ways, I'm actually kind of shaping that response a little bit. I'm doing more of a gradual introduction. So for me, that defines the moment at which I'm going to mark as well. So for me, the mark is going to happen at the point of maximal intensity, or the kind of the furthest progression. So if the very first time I'm doing this is just all about placement, so it may just be a matter of getting the cat into that seated position, mark. Mark and reward at that point. Once that's proficient, then I'm going to raise my criteria and mark the next piece. So we're going to get them seated, get a little head positioning, and then mark that. So my marker is going to move as I go through based on kind of the level of threshold that I'm working. Yeah, great question. And that's going to come up in some of the other videos too, so I'm glad you asked. Okay, so let's look next, if we're looking in the veterinary clinic. This one's going to go sort of light to dark a couple of times, but what I'm going to show you is 2 feline-specific examples of techniques that could be used to get an accurate weight in the clinic environment, ideally without stressing the animal. And what I want to stress to you, these are both going to be videos where the cat is free to move in the space. So if we were in a treatment area or in the lobby, maybe perhaps not doing this would be helpful unless the cat happened to be on a leash and was already sort of leash and harness trained. Now, but what I want to show you in this particular one is, so this is my technician, Jen, and she basically just lifted the cat up onto the scale. It's on a countertop, offers a little bit of dry, crunchy food, which sometimes is helpful, sometimes it's not. And so offers a little bit of food, and we're going to see what happens. Cat promptly refuses both food as well as positioning on the scale, walks away. And again, it's going to go light, dark. You learn things along the way, and that is never videotape in front of a window. Check your placement, check your video. But I like it enough that I continue to use it anyway. So we do this a couple of times. Now, just like we were doing with that previous case, we're always watching body language. So repeat same scenario, lifting the cat onto the scale, offering food treat. Body language is still engaged. Tail is upright. We've got that little bit of a question mark hook there. So the cat is still communicating with body language even as they're leaving, that I'm still willing to interact and play this stupid, silly little game that you want to play with me. I don't know why we're doing this. What I like about this is, though, even though the cat has now refused the treat for the third time, there was a longer pause on the scale, so we're actually getting a certain level of habituation, even though we're not getting a dramatic amount of counter conditioning yet, but now we are. Fourth rep, same food treat. The cat has habituated to the novelty of the scale such that the interest in food is now greater, and we actually get a little bit of counter conditioning. Now, could we have made this go faster? Yes. What if we auditioned other reinforcers? And this is a big part of the process, both for cats as well as for any other species. So would this have gone better if we had added canned food? Nope. But what is the reinforcer that really seems to matter for this particular cat on this day? Yeah, that cat's not going anywhere, right? Does that mean that petting is always a more valued reinforcer than canned food or than crunchy food? Or marshmallows, for that matter? No, you've got to audition the reinforcers. It also doesn't mean that food is always going to be a low-value reinforcer for this particular cat, or that petting is always going to be more valuable. We've got to look at the overall body language and the level of engagement in that moment to see whether or not we're moving in the appropriate direction. And I say that as well because if this is a cat who's coming in for, let's say, a routine wellness exam and is feeling great, petting may be very comfortable. If this is a cat that's coming in for, let's say, a bite wound abscess, and they are physically uncomfortable, or there's perhaps body parts that are physically painful to the touch, petting probably isn't as high on that reinforcer list that day, is it? And how are we going to know that? Body language is going to tell you. The cat is going to respond differently as we audition those reinforcers. So it really is a matter of, not necessarily spending 20 minutes every single time, but within a couple of very quick reps, saying, how about that, how about that, how about that? Awesome, let's go there. And we can get that information relatively quickly for most cases. Now I'm going to show you another clinic-specific video clip here. And this, again, we're in a closed space, not necessarily going with the habituation approach initially, but trying more of the lure, Hansel, Gretel, treat trail sort of a mode to try to get this cat to willingly, voluntarily step up onto the scale. I'm going to point out a couple of things as we do this one as well. So this is Maggie, offered the food, initial engagement, eats the food, watch the timing. The moment she finishes and starts to look around, that's the moment where we create that visual interest and pull her back in with the next one. And so it's both the timing, and watch for it again. Right as she starts to scan, there's the next one. The individual steps that we're asking Maggie to take to get to the next food treat are also very, very small. We collectively tend to make a couple of mistakes with this. And the ones that I see most often is we're either asking for too many steps, and the cat kind of looks at it and goes, not worth it. And then they're done, right? And then they're completely tuned out. Or what we tend to do when we're doing more of a lure technique, especially if we're trying to do it more with the treat in hand, is we offer the food treat, and then as the cat steps up, we pull it. Now, approach the stationary food is a different skill from follow moving food. And what can happen if we haven't trained that follow yet is we create a very skeptical animal very quickly. You offered it, and then you took it away. So really being aware, in this case, we're creating very specific placement. And so in this case, if we had been giving it by hand, my hand is in the very specific place, wait for the cat to approach, next, new placement, approach, new placement, approach. If I've taught this cat to follow, then I could use that differently, but those are two separate skills as far as I'm concerned. There was a question, yes?
Do you do anything with buzzer training?
Repeat the question?
Do you do anything with buzzer training?
With buzzer training. Is that the, what are you referring to?
So, as opposed to luring them to your hand or to a bleed stick, they learn to associate the happy moment, the happy instance with a sound, which you can then put remotely. And you can do it, we use it in TV and film. So, if I have a cat or a dog that I want to go and lick somebody's toes, I can put this easy little tiny thing there and I can be somewhere else.
Gotcha.
Hit a button
Gotcha. You know, so I'm going to repeat the question just to kind of clarify. So using a buzzer trainer, so basically conditioned almost a stationing or more of a tractant to a particular device.
Yeah, so that it could be the scale, or it could be the other scale.
Right.
It could be the table, or it could be the person.
I have, not in exactly that way. I haven't used a buzzer that allows us to do that remotely, but we should chat more because I want one of those. So yes, we should chat and you should message me. With that being said, no, I haven't. We'll use other forms of stationing. So in some cases, we may do that with a mat, for example. We'll see an example of using that with more of a handheld target stick in a little bit later video. So I've done it more in that range. We've also done some object targeting, which we'll see in other ways. I've not done it specifically with something that I can activate to elicit that movement. I haven't. But I love the idea of that, and yes, we should talk more. I think you're going to see some similarities to that with some object targeting that we'll do just a little bit later, but it's going to be a little bit different, so I appreciate you bringing that up. Any other thoughts on that particular one? So again, timing, placement, still working with the different reinforcers. Yes?
So in this example, she waits until the cat's looking around to put down the next treat. Normally when I think of treat trails, I think of them as already existing, like in that true Hansel and Gretel style. Is there an advantage to this over that?
Yeah, so what's the advantage of actually doing sort of individual placement? It's going to vary a little bit on your animal. So if Maggie was a cat who was really flighty and who was really easily startled with movements, that moment she starts to look around, if Jen goes to step in and put food in, we're probably going to spook her. So in that case, I'd be more likely to use the pre-placed trail and just be very deliberate about where I'm placing them. And I might even, if I have the ability to do this, I might even increase the overall reward value as the trail goes on to kind of keep that cat's motivation building. So I might be able to leverage the reinforcer value within the trail versus getting the cat almost habituating to that stepwise movement. With that being said, in Maggie's case, she is a little bit more of a calico, shall we say? And so for her, creating that visual interest and kind of keeping her in the game allows for this method to be a little bit more effective. So I think it's actually going to be placed a little bit more on the individual kind of personality or responsiveness of the cat. You may need to try both. Maggie is one, if we put down 3 or 4 treats, she'll eat the first or the second one, and then she's done with that stupid game. Yeah, so this one works better for her, but it's going to vary. Yeah, great questions. So we're going to switch context a little bit. And we're going to look at different ways of utilizing different techniques. Now, when I'm looking at feline-specific behavior mod, I want to kind of broaden the net for a couple of these videos, not only looking at the behavior modification techniques that we can utilize, but what are some of the observations that we can make, either through direct observation or through video, that may allow us to say, what are we trying to accomplish with our training exercises? So what I want to show you is some baseline footage on this one. Background story, I'm going to pause it here for just a second. This is a cat named Mocha. She's an adult, about 7 or 8-year-old female spayed domestic short hair. We've got another cat in the room, a youngster named Mickey. There's also a Minnie elsewhere in the house at this point, other little kitten, little litter mate. But this is a kind of an introduction session. We're kind of seeing what happens. So what I want you to watch for is the body language exchange between these two cats. And just based on what you've seen so far, I'm actually going to rewind and then play again. Based on what we see, does this look like a completely friendly interaction? I'm not getting that full upright tail, and this is going to get a little bouncy. I apologize for that. The tail was initially upright, and then it dropped a little bit. Now we've got strategic placement in the door, so blocking access. Upright tail, I'm willing to interact. See, look how willing to interact I am. I'm flicking my tail at you. Can you see that? Not reciprocated. Little bouncy, bear with it. And then he sneaks out without actually engaging contact. And there's a little bit of a fast movement coming through that bottleneck, that narrow spot there. Had that door been open a little bit farther, it actually would have been easier for him to exit that room. So this is something where we've got these two cats where this is not overt stress, meaning I don't see any overt hissing, spitting, swatting, aggression, anything like that within this particular clip. With that being said, I'm not necessarily sitting back on my heels either and saying, oh, these cats are getting along fine. there's some stuff going on here. So what are some of the different ways that we are able to move some of these relationships forward? I'm going to give you a couple of different examples that we may be able to work on. So this is more of just a straightforward classical conditioning exercise. Here we've got Mickey and Minnie on the other side of the gate. We've got Mocha on this side of the gate. This towel is there in their case because for whatever reason, Mocha was really crowding the gate and the kittens were less interested in eating food. So this is just a little bit of a barrier that keeps her off the gate just a little bit. It's not going to work for every cat, but it works for Mocha. And so it creates just a little bit of a barrier. If we're doing anything like this is obviously a double stacked baby gate. Is that enough for all little kittens? If there's a little 3-inch gap up at the top, are those kittens going to come through that gap? Absolutely. Maybe not the first day, maybe not the second day. But it's a great option that gives us the ability to do that. So in this case, we're talking more about just classical conditioning. There's not anything expected of either of these animals. We're not looking at any trained sequence. It's really just classically associated, you're on one side, I'm on the other, and food is happening. Yes? So is this an intro, or do we have a history of aggression towards another? This was an initial intro, and this actually occurred prior to this one. The kittens are naive. They're kittens. They're fine. Mocha has a history of aggression to other household cats, so they were taking this introduction very, very slowly. And what I love about more gradual introductions is that I don't necessarily set out an entire time span. I'm not saying you should take 10 weeks to do this. I'm not saying you should take 10 hours. I'm not saying you should take 10 minutes. I'm saying you should do it in stages such that we can check our progress and make sure that all of the cats are comfortable throughout this process, and that if we start to see any signs of tension, we can either go back a step or persist at that level before we raise our criteria or the level of exposure. So in this case, we're looking really just at more of a classically conditioned association. And sometimes that goes well, and sometimes it's not exactly what we recommended, right? Do your clients ever misinterpret or do something different, right? It's gonna happen. So what are we looking at for some of these other, this is gonna be 3 different examples of using kind of 3 different methods, 3 different setups. There's pros and cons of every single one of these. I believe we're gonna start with the top one. And this is a scenario that's actually relatively similar. We've got a stacked baby gate scenario. This is a kitchen environment. We've got a youngster, newcomer to the household, and the resident cat on the other side. Client is attempting to do, again, more of a classically conditioned association here to say, yes, you're both on opposite sides of the gate. When we put you in these environments, then there's going to be food happening. There's a couple of things that are good here, a couple of things that are not as good. Let me pause the video and then yes. Yes?
So the new kitty is the kitten
Correct.
in the kitchen.
Correct.
And was there a reason for picking who was on which side?
That's a great question. So where do we put the cats during these introductions? It's going to vary a little bit. In this particular household, the kitchen is a place where this kitten is able to be confined. It varies a little bit, and this is I'm going to kind of talk around your question just a little bit. In certain cases, if we have a resident cat, taking them out of the core area and giving the newcomer an opportunity to explore can be helpful in giving them an opportunity to establish a little bit more residency. And then reintroducing that cat can be helpful. With that being said, if you really think about the sort of the natural introduction method, if we're talking about, let's say, a free-living colony of cats, and if we have a newcomer, there's often, not always, but often this period of kind of life on the periphery where that newcomer kind of gradually works their way into that household. And so I'm more likely to set up the exposures in exactly that same way. So if I put the newcomer in the core territory, that I find for certain resident cats can be more upsetting and more of a disruption to what their kind of normal species-specific social organization would look like. In some cases it's necessary to make progress, but in most of the cases I'm more likely to have the newcomer more on the periphery and then trying to integrate them in to mimic that natural specific. Yeah. So in this case, we've got the little kitten in the kitchen. There's food available for the kitten. Is there, at least based on what you can tell, is there food available for the resident cat? No. So if we're really trying to counter condition her response, who really needs the food? Right? So a little bit of a fail on that one. Kitten is, as best we can tell, is not overtly affiliative. We're not seeing bunting, we're not seeing rubbing, we're not seeing direct approach, but the body language is relatively appropriate. Tail is upright, cat is engaging in normal sort of maintenance, grooming, and stretching behaviors. Now we're in a little bit closer proximity. We still don't have any significant food present at this moment, and this is now kind of the point of maximal intensity. If anything, this is the point where we should be having that food placed right here, right now. This cat's a little bit more direct than I'd like her to be, so it tells me that she's a little bit more offensive, or at the very least, intensely curious. And we see the little kitten moving away rather than walking up and bunting or rubbing. So it tells me that what this client is really doing, because they've missed the food on this side, because we're not really timing the food in any particular way, and we see a little bit of that hesitation on the kitten side here, what we're really doing here is, rather than this being a classical conditioning exercise, this is actually almost more of a habituation approach. They're just kind of both there, and we're hoping that they acclimate to one another. And that has value in certain cases, but if I really need to shift the emotional response, creating a contingent relationship between the presence or the appearance of the other cat and that association with food is critically relevant to getting that emotional shift. Yes?
Is bunting headbutting?
Is bunting headbutting? Yes. Yeah, so we're getting bunting, so like if it were that cat who was sort of bunting against here, it's typically that rub with the cheek. Yeah, so bunting is more the official word for it, but yeah, headbutting is kind of the same behavior. Yeah, bunting is, all of those, I know, why couldn't we just call it one thing, right? Cheek marking, headbutting, bunting, same behavior. Yes?
So I come more from the dog background than the cat background. And so when the kitten was in there and was doing the scratching, I mean, how do you know if that's truly grooming, or do cats use scratching as a displacement behavior?
Great question. There's actually one study that was looking at an increase in self-directed grooming behavior in cats immediately following a stressful interaction with another cat. So you got to watch. If it's just a single event, I think it's important to ask the question, what was that? And if it's just a single event, we may not know. Okay. If the cat moves away and then engages in more appropriate grooming, and that's the only time we see it, then we're probably okay. But if we start to see a contingent relationship as we get into closer proximity, we get more displacement behaviors, then that's probably an indication that we're either pushing threshold or there's some degree of conflict or stress associated. So that part is very much the same for cats as it would be for dogs. Yeah. Any other questions on that one? Yes?
Would it ever be valuable to provide food for the resident cat that doesn't seem particularly happy about the kitten? So just with kittens doing fine, it's really not worried. Give the resident cat food and not provide it to the kitten, so for the resident, it even amps it up a little more. Like, wow, you get your own special treat.
Right.
Is that ever helpful?
So is that other helpful? I'm going to repeat that just so we've got it on audio for the video as well. So would that ever be helpful in a case like that where maybe the presence of the food in the kitchen is creating a level of arousal or tension or competitive behavior for the resident cat? Are there times where it would be helpful to remove that but continue to provide it for the resident rather than the newcomer? There are times where we can leverage that. And so if it looks like that is, we have to try it on for size and see whether we get the right response. But that's going to be a good question. So if we are working with that little kitten on the inside, we might say, does this cat need the food reinforcement? Or if this cat is reasonably comfortable, maybe it's less important there and we can remove that added arousal factor. So there may be times where that can work well in our favor too. Yeah, great question. Okay, so next video we're going to look at is slightly different. It's a little bit less controlled. So in this case, we're going to have this cat in the kitchen, loose. This is a cat with impaired vision, just FYI. There's like a little bit of a gait abnormality there as well. He's a newcomer to the household. He's been allowed in. The owner is going to be coming in here with a cat on harness and leash. And she's, again, attempting more of a classically conditioned introduction between these two cats with some pros and cons along the way. This cat is not restrained in any way? Here we come. So question for you. This food that's being given right now, is that part of the conditioning? No. It's not until we create some degree of awareness, right? So attempting more of a classical conditioning, so not requiring, not giving any sort of operant cue, that moment of first awareness would have been the exact moment to provide some food reinforcement here. Food is present, but it's not being consumed. And so our timing's a little off. If we're trying to create a contingent relationship between, let's say, line of sight and presence of food, we need to be able to do that. So in this case, if this cat's, and it will turn back upright in just a second here. This is the joy of owner videoing, right? You're like, okay, let me go this way for just a little while. Do cats eat food quickly, readily, reliably? No, they don't. So sometimes the timing gets a little tricky. It's a big difference from working with most of our canine patients. Now, once this cat's attention focuses fully over here, are we counter-conditioning at that point?
Come on, Ace, come.
Depends, right? So if we're getting a level of awareness where this cat is sort of glancing in the other's direction, and then especially if we mark or provide that contingent food placement at that point in time, we can create an association that, oh, when you notice that the other cat is here, something amazing happens. Again, back to classical conditioning. Do we always rely on classical conditioning for these greetings? Nope. What I want to show you is more of an advanced exercise, or kind of more of an endpoint version of that. We're going to look at the video clip in the bottom right. And what I want to show you here is not the starting point. Unfortunately, we don't have that on video. But we're going to show a cat who there's going to be one on the inside. There's a screen that is closed, so we've got a barrier in between. There's a cat out in this 3-season porch that's going to be on a blanket or a mat on the far side of the room. And this was a cat who was initially trained using a marker, handheld clicker. We initially created that positive association that when you look at the other cat, we mark that with the click and then reinforce to the side. Essentially a version of the look at that protocol, if you're familiar with doing that with dogs. So click the look, feed to the side. Click the look, feed to the side. Click the look, feed to the side. What usually happens very quickly is once we get a certain number of reps, which varies for every single cat, we get a cat who looks and is already thinking the food's coming, and they disengage on their own. And then what we transition to is what we're going to see here, which was now we allow the look and we mark the disengagement. And that's really what I'm referring to here is clicker training for active disengagement. When I have a cat who tends to be very focused, who is more likely to engage in more of that stalking, predatory type behavior. It's not actual predatory behavior, but it's more direct and focused. We're more likely to use an operant exercise to get them to get reinforced for disengaging. And I'll give you another story about another cat that we use this for after I let this video play. The timing is not perfect on all of these episodes. You'll see a couple of clearer examples here in just a second. So again, this is the point at which we are they're actually both resident cats. There isn't a newcomer in this case. This is an ongoing conflict that's been there for multiple years. So this is the victim, not necessarily resident or newcomer, just the victim or the target. And again, you'll see better examples here. That's just kind of all the setup. You'll see a couple of clearer examples here. Lily looks, disengages. Timing was a little off. That was a beautiful one that we could have gotten and they missed it. Dang it. Alert, disengagement. That was perfect.
Nice.
No, I need you to look at Jenny. There's another one. So we're actually conditioning the disengagement. That's really what we're targeting in this particular case. So this is one scenario under which that might be useful. We had another little kitten in the practice that was, I would say he was probably about 15 months old, very precocious, also blind. And he would target one of the geriatric cats in the household, and whenever he saw or heard, or not saw, when he heard her or became aware of her movement, he basically harassed her. It wasn't overtly aggressive, but it was creating a tremendous amount of stress for that other individual. And so we used this protocol, ironically, even though he was blind, we taught him the initial click-treat association, did the exact same thing. When he alerted, which you could see in his body language, that ear forward, that little bit of a head raise, we'd click and treat. And then very quickly, actually in the very first session with him, he caught onto it so quickly that within about the 8th rep, we were already clicking the disengagement. And so we went from cats who could not be together because of that level of harassment to within 3 days, allowing them to have full integrated interactions. And those training sessions initially were very structured, and the owner would click the disengagement, and then we would be able to gradually allow longer and longer periods of integration. And so for him, he latched on very, very quickly. I think partly because we didn't have a strong emotional reaction that we were trying to counter condition, we were providing other enrichment opportunities for him as well. So combination therapy. Yes? What do you use if you have a cat who doesn't hear? Depends on what they're going to be most responsive to. So what we do, and we work this a lot more on the canine side of things, and we're more likely to use a flashing light or a flashlight, just as some sort of visual stimulus, which we then condition right from the get-go of flash, treat, flash, treat, flash, treat. We've used vibrating collars for the dogs, which might be a little bit harder to do on the cat side, depending on how big the cat is. But any stimulus that they can perceive, I would be open to doing that depending on the context that we're working. It might even be, like a stomp treat, if we're trying to work with vibration. But it could be any of those variables, anything that seems to be something the cat attends to without showing any sort of avoidance or aversion. Yeah, good question. Okay. I am going to skip that one for right now because I want to show you this other one instead. So this is a cat. Oh, let me back up just one second here. This is a cat named Nils. He was a youngster, about 2 years old, had a really traumatic experience in a carrier during a car ride. We don't actually know what it was that triggered him. He had been back and forth to the vet a number of times. It hadn't been he didn't love it. They hadn't done preconditioning for that. He didn't love it, but it wasn't a major factor for him either. And he had an episode where they were on their way to the vet clinic and something changed. And he basically, while the owner was driving, went into, as best we could describe, more of a panic attack. So started excessive vocalization, violent thrashing to get out of the carrier. Ended up urinating, defecating, and violent. From that moment forward, any presentation of the carrier created a very, very strong aversive response. So we could say, well, that's okay, maybe we switch over to home vet care, kind of avoid the carrier issue, maybe we do it that way, which we did. This is a family that RVs for 6 months out of the year. They like to take their cat along with them. Carrier training and movement in a vehicle is kind of a part of their lifestyle, which creates a major, major conflict. So this was a little bit unique in that we were really focusing on trying to get to an endpoint. What I want to show you in this is one way of starting to work through this process using a variety of different techniques. Now, initially, because he was so aversive, so avoidant of any presentation of the carrier, we couldn't start there. And that's a really big deal when we're working any level of BMOD for any species. We're always starting with what is possible, not putting them in the situation where they're eliciting a negative emotional response, but what is that starting point where they're just beginning aware. Now in this case, we actually started with more object training. So this is something that would be back kind of like to the buzzer training, different version, but a little bit of a different approach on that. So we identified an object that might be novel enough that Nils would want to approach it. if our goal is to time this at the moment of contact, was that a well-timed click? That's not right. You learn a lot when you ask your clients to video for progress. She got stuck in the click-treat association and forgot what we said about what is the moment that you're clicking. She was basically like, yep, he did something good. Click-treat.
Okay, you lost him.
And didn't catch on to that idea of utilizing as a bridge. So he's doing the behavior. Now, one thing that changes for a lot of our household cats who aren't necessarily accustomed to doing this, they're not border collies most of the time, some of them are, but most of the time we're going to get much longer delays between repetitions, between successful reps. I find that it requires a much greater level of patience, and it's very tempting for many owners who are being coached on this. They really start to lean on their prompts. Go touch it. There it is. You know, we get some of these sort of artificial prompts that we then have to fade later if it's not actually a part of the sequence that we want. So you'll see some of that as we go through that as well. So that was one thing, just initially getting started. Can we condition approach to novel object? And we're going to work through a couple of different. So now we had worked up to he was doing that a little bit more consistently. We gradually moved it. Now this was not the next step, but we moved that, allowed the carrier to be in the room at a distance, and eventually took the lid off, which changed the visual appearance. There's the too much. Let's make it a little bit more visible. Nice. So now we've got our timing. She was also coached to toss the food away to essentially reset, so that the cat had to re-approach again versus he's just touching, touching, touching. We wanted to get the active approach. And even when the cat understands the game, they don't always do what you want them to do. Now in this case, we're like, whoa, we just jumped criteria, right? He did exactly what we wanted him to do. Should we click and treat that? Yes. Yes. She was focused on, but he didn't touch the object. So she lost sight of the goal of what we were doing. We're like, okay, coaching, right? She's never done this before. So we lost an opportunity to like launch everything forward like 37 steps in one fell swoop. But that's okay. It's okay. Not going to make her feel bad about it, right? Because we can't go back and redo it. So you get these long delays in between. Do, do, do. Do, 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 do. Do, 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 do. Oh, we're still playing that game, maybe? Are we? You know, this is a part of the process. Missed it, right? For our goal is that she got so focused on the object training that we lost sight of why we were using the object in the first place. Then we come back to clicking and treating the object. So fine, we will continue to make progress, but probably not as fast as we otherwise might have done. Did I see a hand? Yes?
Is that the exact carrier that he had a...
Is that the exact carrier that he had a bad reaction in? No. It was a soft-sided one that he was in before, so we swapped that out to be able to try to create, as much as we could, a novel or a different experience for him. Yeah, good question. And that can be really helpful for cats, that if there's a way to make it look or feel different, we may be able to kind of start over a bit more easily. So you get the idea of this. So this is, again, all about placement. You can set the criteria based on what you think the cat is going to be able to do. I'm going to escape out of that one here. Next. Oops. There we go. So in this case, carrier, entering. So now we're at that point. We're like, okay, well, let's work on clicking and treating for entry to the carrier. Let's raise our criteria. Sorry, it's a little muffled on that right hand, that left-hand side there. We also coached her on that. If we're going to give you really good coaching. So at this point, she's clicking and treating. He's remaining in the carrier. So he's not actually getting the primary reinforcer. There's potentially still value in hearing the click. But even when I watched that, I had to ask the question, what were you clicking? What were you marking? She was like, well, he was still in the carrier. And we said, well, were we clicking duration yet? She says, what do you mean? I don't know. So perfectly appropriate to do that in this case, but if we're clicking duration, I would either want him to be in there for duration, click, and then come out for food, or I would deliver the food to him in the carrier so I can build duration in there. So again, a little bit of coaching. Meanwhile, we're just sort of littering. Right? So, and then he'll come out and just clean up the floor. So progress, we're definitely getting there. And so this is one of those things where even when the client isn't doing it perfect, are they still able to make progress? Oftentimes, yes, because of or in spite of what we've coached them to do. So we can get all of these different versions of what this looks like, and then again, getting our coaching. So we're at a point where he's entering the carrier willingly. Let's go on to the next one. We've added the lid.
No.
But it's not fully on. Sort of a graduated kind of creating a little bit more of that confinement space that's been so freaky for him. So this is going to be a starting point for getting him up to full carrier. She's also doing a bit more of that. Again, we've got some duration, delivering food to the cat in the carrier rather than asking him to come out and reset himself. So at this point, we're building duration in as opposed to anything else. That little startle reaction that you just saw, that's very typical for Nils. It's one of the reasons why I never get too picky if she takes longer to get there. He is very, very, very much a slow and steady cat. If you push him, he is done. He is done. And generally speaking, it's not, he doesn't work reliably. He does like to play on his iPad. Yep. So if they leave the iPad out, that's a signal that he's ready to do some work. When he engages the iPad, then that's a signal that he's more likely to engage in the training exercise.
No, because you sat down.
What's that? Yes, exactly. Giving him a lot of freedom, a lot of control. I'm ready now. I love getting a ready signal. So here where he's in the carrier, full lid on, building duration. Yes, both. Nils gets aroused very easily. So even just with the training arousal and that prolonged contact, we do see signs of sympathetic nervous system activation for him. So we do try to keep his training sessions relatively short. But he's at a point now where he's in there with the door closed. So huge progress from where we started from. Initially, when they had tried to put him back into the carrier after the first traumatic event, it was very difficult, number one, to get him in there, which is more of a physical process. And any attempt to close the carrier door elicited an immediate panic reaction. Not just vocalization and distress, but again, thrashing, urination, defecation. So probably one of the worst reactions that I've seen. Let me just switch the slides here and then I'll get to your questions. Come on. There we are. Yes?
Would another option instead of, I think as a vet tech, it's fabulous to desensitize him again to a different carrier. But would another option for him because of the RV activity to have gone the way of the harness and the leash instead?
Yeah, so could we have gone harness and leash training with him instead? It actually, for reasons that I don't fully understand, even the first time we attempted to introduce that elicited actually the same reaction for him. Just any sort of restraint body contact, it created a very similar reaction. So we kind of weighed the two options, and they felt more secure going the carrier route where they'd have a way to keep him maintained, because when he panics, it's a big deal, and they were concerned about what could they do. At least if he's in the carrier, they could let him out if they needed to. Yeah, but I completely agree with what you're thinking. Just troubleshooting, what is our actual best eventual goal from a strategic planning standpoint? Yes?
What about along the same lines that she was saying, the different carriers, like the different doors leading? Sometimes with dogs that are nervous about getting in the car, having the doors open so they can come and go out, come and go out.
Yeah, so would we be able to open up, get a different carrier with multiple doors and create more of a sense of you can come or go as you want? would absolutely be an option. And if we had gotten to the point where we had the door on and the closing of the door seemed to be a trigger for him, then swapping out the carrier, having a second door open and getting him used to closing the front one would have been a really great way to break that piece down into a further chunking.
Using this crank because he had issues with sensory overload too, or not? Just because it's a plastic one versus a wire one?
Because of sensory overload, not necessarily. This was just different from the one that they had before, so this is where they started, yeah. And if he had shown any significant aversion to this one, we would have potentially tried something different. Yeah, yeah. Yes, absolutely, yes.
Business question.
Yes.
Freelance behavior consultant, how many billable sessions would that be?
Oh, good question. So from a billable question or billable session standpoint, these were videos that the owner was doing sort of in between sessions. Nils doesn't work well with a consultant in the home. So my trainer was going out. What we started doing, actually, we modified our method for Nils in that we would basically say, record the video, send those in, we'll do a remote coaching session, you have the videos pulled up, we'll have the videos pulled up, and we'll troubleshoot exactly what we're gonna do, and then we would do more of a live Skype session with them. So basically our time is however much time we spend with them. So they're kind of off doing their own work, and then any direct contact time. So how many sessions was this?
I do that a lot too with the remote, and usually at this point I've been really billing for it.
So we bill for everything.
Okay, that would help.
Yes, yeah, we bill for everything. Basically, if it's a quick little 2-minute email response, quick little, nice job, keep up the good work. Cheerleading is free. If I need to break apart something or give them any significant instruction about next steps or anything like that, then that's going to be a billable session. For these, we often bill these just as 15-minute sessions.
Okay.
So it's not necessarily where it's a standard, a BMOD session that averages 45 minutes is this cost. We do everything by the hour, or at least we were at this particular point for these clients. So being a little bit creative just to make sure that whatever time you are investing is being captured within your billing. Yeah. Yes?
I understand that the duration of each individual session will be longer perhaps than it would be for a dog. But how many times a day, a week, what's the...
So what's going to be the frequency of sessions? And back to what you said about the duration of sessions, it's variable. The duration between reps is often longer, but the duration of overall session is often shorter. We just get fewer reps, which means we often have to do more sessions if we can in order to get that same level of progress. At least that's been my experience with a lot of these cats. So shorter sessions involving fewer reps, doing them more frequently is generally what we're looking at. And rather than giving any sort of recommendation of, it should be this number of times per day, per week, per month, I ask the client what's doable. How much time are they willing and able to invest in this process? And then we'll reevaluate in 1 week, 3 weeks, 3 months, whatever the time frame is, to see what progress we're making. And then we can decide at that point whether that's enough or not. So it's kind of, I'd rather have them do what they can do and do it well, rather than giving them sort of arbitrary numbers that I can't fully justify. So in this case, we're working more on full entry into the carrier.
Good boy.
Yes?
We have a problem with cats getting into cat boxes.
We'll talk about cat boxes next.
I mean, in pet carriers.
Okay?
But at home, they think you're really going to kill. They get in and they're fine. They travel to the bed and they're fine. They get out of the bed and they want to
Look up.
As soon as the bed comes in, all they want to do is jump in the cat box that they didn't want anything to do with in the house.
Yeah. So a lot of times, as we're watching this, I'll answer your question too, and that is actually, let me pause this for just a second. So when we see kind of a shift in their behavior, just to rephrase the question, if we have a cat at home who shows a lot of reluctance or resistance to go in the cat box, once they're in, they seem to be okay. And then if they're at the vet clinic after they've been out roaming, you give them the opportunity to go into the box and they're more than happy to hop right back in. It's often about where they feel most safe or comfortable based on the difference in their environment. So if they're in their home, they'd probably much rather be up on a perch or somewhere else they're going to feel more safe there. Going into the box in the home is not the place where they feel safe and secure unless it's been conditioned in some way. In the veterinary clinic, where the entire environment is relatively novel and perhaps a little bit over threshold, the safest place may be a hide box. So it's kind of the difference in their perception of safety, at least that's the way I interpret it, based on the changing in the environment. What I would also look at too is anytime I'm looking at, let's say, in the carrier, fine, I'm also looking at that cat in that environment to say, are they truly fine? Are they tolerant, or are they truly enjoying that? And that's kind of where we have to kind of really look a little bit more detail to figure out exactly where we are and whether additional conditioning would be helpful. What I want to emphasize on this one is this is the point where we were at a point in his process where we said, okay, he's going in and out of the box, doors closed, he could be in there for up to about 10 to 15 minutes at a time, intermittent reinforcement throughout, that's all good. The moment they made a move for the handle and he felt any instability, immediate reaction again. So what we started working on with him is a variety of novel substrates, novel flooring. So this is a little piece of like a floor linoleum surface with a large Ziploc bag with water inside. So as you put weight on it, it just kind of moves and it's a little bit unsteady under the foot. And so what we're trying to do in this case, and what they were supposed to do but didn't quite go back to doing, is we said now that we're going back to this, rather than relying on the hand prompts and all of that, this would have been a perfect time to go back to using that object target again to get him back to approaching. And they didn't do that at this point in time. They were supposed to.
It's a good treat. Do I load it again?
So getting him accustomed to just different surfaces was a helpful part of this.
Yes,
He didn't always understand exactly what we were trying to get him to do,
yes.
but we're getting there. So there was almost nothing in that bag underneath, and then as he got better about it, we kind of made it more and more challenging.
Good boy.
Back to work, Nils, back to work. And then in other cases, we made him a little wobble board
Now you want to load this again?
to be able to, again, get used to that shift. So just kind of looking at it from different ways. Now, in the normal sense, if we were trying to desensitize that carrier movement, we could break that individual sequence down. Approach, hand on, hand, movement of handle, very slight movement. We could break that piece down into smaller chunks, and we did. It was really tough. So we're like, well, let's give them something to do and see if this helps us out. And it really moved us along a lot further for him. So more of a documented process along the way for a cat like Nils. Any questions on him? Yes? Did we ask them to rotate where they're doing the training with the carrier? Yes. He was easiest to train in their living room. And so this is one of those cases where being very specific about it, basically saying anytime we are trying to advance or raise criteria, do that in the living room where he's most comfortable and are most likely to be able to do it. And then at other times, while you're practicing some of the easy stuff, generalize that across other environments. So we're not trying to push him in all different ways, but pushing forward and kind of bringing everything else along in the process. Yeah, great question. Any other questions on Nils before? Yes? Is this still in process? Yeah, it actually is. Unfortunately, it's taken a lot longer than I wanted it to, both for his responsiveness to training. The owners also had a number of distractions in their own life. Some medical issues, partial home remodel, things like that, where they're like, we're going to be kind of on standby for a little while. So we're not making as fast a progress as I would like to make. The good news, if there is some benefit to this, is that because of the medical issues, that took the pressure off them for doing the RV stuff too. They needed to stay close to home. So I think that also worked for us in that we didn't have the pressure, and against us because we don't have the pressure. Their motivation to keep moving on it has really waned a bit. So would I consider medication for him? He actually has been on meds at various points within this process, either situational or maintenance, to see what sort of an impact we could have. And it did make a difference. We really reached for that when they were gearing up for the home remodel. And I was worried about his startle reactions, his overall level of baseline stress, and also knowing that when he has a panic reaction, it creates such a strong aversive conditioned emotional response that we were trying to create as much of a buffer to hopefully not have anything else that goes the way of the carrier in the process, especially since they were going to have to confine him in rooms and there was going to be noises and all of that sort of stuff. So he had been on medication for a while. Yeah, great questions. So this is another much, much shorter, much more simple case of just thinking about creative problem solving. So this is a cat named Asparagus. Gus for short. His primary concern was a combination of attention-seeking behavior as well as owner-directed aggression when she attempts to do something to him that he did not ask for. And he has a very, very short fuse. So if he were to react aggressively, let's say she were to go to move him off the couch, for example, or in the kitchen, move him off the counter while she's cooking, that would result in a severe episode that might involve full-thickness bites. So he's not subtle. It's not that little, swat, go away. He's very offensive in that moment. And so this was a solution that we created for him.
Started. You want to jump up again? Up. Good.
And so the concern for her in the kitchen was him being on the counter. He really likes being involved. He really likes food. He likes being on elevated surfaces. What we had to really struggle with in this case was, number one, a couple of pieces, clicker training, so introducing the clicker. He picked up on that very quickly. He's more the border collie version of cats. The target training was helpful because we went that direction versus an object or something else because we wanted it to be portable for her, that if he was on the couch and she needed to move him to the floor, we would have a portable way of doing that. So something that was going to be versatile across multiple areas within the home. And then in this case, creating that little pedestal for him. The challenge was here is once we got him to this point, we had to be very clear about where that was placed. If we moved it a foot or two in any direction, he was able to easily make the leap from here to the counter. So it didn't quite accomplish what we wanted it to do. We had to be like, okay, no, back over here, and then a little bit there. And so then it was a matter, once he learned that, we put this on more of a verbal cue. And I forget what she used for him, perch or something to that effect. And she could cue him there and then intermittently reinforce him. So she would, while she was cooking or baking, would have a little cup of cat treats on the counter, and she kind of had a little mental timer of when and how to reinforce that. And he would happily just hang out on his stool, get intermittently reinforced, and when they were done in the kitchen, she would leave, he would follow, and they'd go about their day. So it was a very specific use of a couple of different techniques, both with stationing and target training, building duration. And this is a client who had never done any degree of animal training in her life and was kind of a natural in some ways and really found it to be quite fun. So perfect example of one way to utilize that. Okay, oops, let me go back. So, yes, Boomer. So this Boomer is a case where we're looking more at, again, this is going to be more of a progression. I may not get through all of these videos, but I'll give you some examples as we go forward. Boomer is a case that I evaluated for lack of consistent litter box usage. And I'm going to plug a couple of things as we go through this with Boomer. Some of these clips are a little bit long.
This is kind of how we can tell that Boomer needs to go down and use his box. Instead of going to use his box, he goes and finds a place and hides. And then we have to kind of see if we can catch him and drag him out.
Is that normal? No. So we've already got some red flags associated with the overall elimination sequence. Are his pupils dilated? Yes. So again, this is sort of baseline. This is where the clients are starting from.
No, you stay there. I know you need to use it.
And this gives us a lot of information. Gives us a lot of information about where they're starting from and kind of what their instincts, what are they doing. It tells us kind of what we're going to need to work on in the process. So we try again.
Go get him again.
It's gonna be a chase.
Okay, I'll shut this off. Okay, we're going to try again. He's hissing at Suze.
You be a good boy. Stay right there and use it.
You're the one in the picture.
You also get a sense of the marital stress level within the home in the midst of videos.
Honey, if I
So
don't leave
when,
my...
we'll kind of work our way through here. So now they've closed the door. It's not possible for him to leave the room.
Well, we know it's a poop day. So we're down here in the cat room. I gave him some crunchies. Let's see if he'll go into the box.
That's the exit door.
Kind of doing his
So it's good that he's nice and calm and relaxed. Or not.
It's 4:30.
You see this level of agitation? The tail tells you that. You've got your body language cues, the pupil dilation, the placement in the room, the head shaking, self-directed grooming, that level of agitation and tension within his body movements. So where does he normally eliminate? It's usually on another level of the house if he goes. It's not terribly consistent. Yes.
Really just wants out.
Yes. So so that's a great question as well. So how often does a cat normally defecate? At least, yeah, once, twice a day is pretty typical for most. He defecates about every 48 hours. Is that also part of his diet and water intake? That's a great question. We'll come back to that.
How many litter boxes are in the house that where are they located?
So he's got multiple litter boxes in multiple areas of the house. So it's not an access issue. He's the only cat in the household at this point in time.
Are they all covered with uncovers? Are they all covered like that one?
Yeah, and if we get to see all the videos, I may skip through them. You'll know why they're the ones that they have. He's one of those squat to raise peers. So having the high sides is really important from the standpoint of keeping all of the urine in the box. So there's this long protracted, I'll come back to some of these other questions too, there's this long protracted sequence. So ordinarily what we would expect to see when a cat needs to defecate would be voluntary movement to the box, right? Sort of investigation, pre-elimination investigation of the box, perhaps preparing the substrate for elimination, posturing for defecation. There's usually a spin or a twirl or two as they're getting themselves in position, and then they pass that stool relatively quickly, plus or minus covering afterwards, and then exiting the area. So this is someone holding the camera. Yep, so they're present, and that doesn't really seem to impact this sequence overall. He goes through this whether they're present or not. But what I wanted to really emphasize here is how long, so that hiding behavior, the avoidance behavior, they're able to pick that up usually anywhere from 5 to 15 minutes prior to him actually eliminating. So he gets the body language changes happen, but the entire sequence is off. Now, are the stools normal size? To some degree, yes, they're a little bit larger diameter than they should be. He's also only defecating about every 48 hours. So then the question is that because of usage or not? So so as we kind of move through this section.
It's like he's gonna poop, I don't know.
Now he's actually defecating.
Yep, that's what he's doing.
So has pain been ruled out? Not as much as I would like it to be. And this is a good question. So he is a youngster. He's about 2.5 years old. This is our baseline. So before I get to the BMOD side of this, like when we get any baselines that have these sort of abnormalities, again, this is not something where we can just say, hey, let's do BMOD, right? There's something else going on here underlying this entire issue for him. This is a big part of Boomer's history. So, coming back to some of those other questions, Boomer is actually very, very difficult to handle in any sort of a restrained way. There's actually a moderate amount of owner-directed aggression, which may be related to whatever underlying issue he has as well. He is a nightmare to handle in the clinic. So at this point in time, any exams, any procedures, any blood draws, any radiographs, anything like that, do require full anesthesia for him, or at least heavy sedation. Budget is not as much of a concern, but they do have welfare concerns about the level of stress that he experiences. And they also know that when he experiences one of those episodic stress situations, it usually takes him anywhere from 7 to 10 days to fully re-regulate back into normal routines. So it creates this conflict for the owners in terms of how far do you go and what do you do, what's going to make it better, what's not. So there's a lot of other variables that get tied into here. Yes?
How long has this behavior been happening?
So how long has this behavior been happening? It's a good question. It's not immediately clear. It's not acute. It's been there for a while. And then to some degree it's been not dismissed, but downplayed from the medical standpoint because he is a youngster. And the stools aren't consistently soft, they're not consistently abnormal. And a lot of these observations, the owners are very, very diligent cat owners, but not terribly educated in terms of body language. So until it was raised to them that certain aspects are abnormal, they didn't really have the data to bring that to the vet to say there should be a greater level of concern here. Yeah. So, yep. Oh, give me 1 second.
Are there other options when the cats do the kicking thing or the urine goes elsewhere besides the covering?
So I'm gonna table that question because it's gonna be a little off topic for right now in terms of that, but I'm happy to chat with you after about that. That was gonna go into more in the elimination. Yeah, absolutely.
Okay, time to click or treat.
Yep, he knows. He knows. That's how it goes.
We'll get there.
You wanna go pee? Go ahead.
Freebie.
Pee. Oops, sorry. Oh my, got away from me. Got a freebie.
Well, we're just...
You're gonna have to be quiet though while he's doing it.
He took to clicker training really well. We actually get a lot faster repetitions for him than what we would get for a lot of our other patients, which is awesome. Pardon me? Yeah. Where is that coming from? He is actually very physically avoidant of all handling in every context. Ironically, that got better once we got pain under control. So client says that's as far as we ever get.
Click or treating just gets him to the edge there. It doesn't get him in.
Well, because I can't put the treats in the litter.
Right? Who wants to really give a big click right
What
there?
happens if you put it on the edge?
Right?
of the
Both
litter
feet,
box?
go, go!
And it gets in the litter like it's doing. Yeah, it's really
Right?
Well, this
And
is
then
one
here's the
for
challenge.
Chris. Is
Do you click and interrupt the sequence if he's actually using the box? No, then they're like, what do I do? What do I do?
Okay, so butt down, and he's doing what he's supposed to do. Nope, there we go. Let him stop, Suze. Let go.
No,
Let go.
I want him to, I don't want to have to
But
clean
I
it
want
up.
Doc, I want Chris to see what
He
he
doesn't
does,
like being
not
touched.
what you hold him
Yeah,
to.
I know, right?
I don't want to have
The
to
clients
clean
were,
it up
they
off
were
the
really
floor.
good when you gave them specific instruction, but if left to their own devices,
Well, I think it's a little harder for
and
him.
then he's done.
For Chris to see what he's doing if you hold him in a different position. Oop, leaps out, jumps out. Now let's see what he's doing. He jumped out.
So we're able to get some sequences. He does use the litter box at some point in time, back to someone else's question. He does use the litter box some of the time, so it's not a 100% issue. So focusing on a BMOD standpoint here, we could discuss all the other stuff. We eventually were able to get him anesthetized, get him worked up, get him evaluated by an internist, got the dietary recommendations under control as best we could, basically re-regulated the GI tract, which normalized a lot of the sequence. It really reduced that pre-defecation aversive moments for him. And then by moving forward on the clicker training, we eventually, I'm going to skip forward on the rest of Boomer because I want to get to a couple of other videos here too and give you some time for questions at the end. What we eventually got to for Boomer was a point where he was using the litter box reliably for urination. We did transition this for him. Rather than utilizing this box that has sort of the jump in here, we experimented with a large high-sided box on like one of the Rubbermaid totes. He's more than willing to jump in and out of that. So it prevented that whole holding his butt down thing. So more from a management solution, it made that a little bit easier for him. And we can talk more about that later as well. Urination became a non-event. He was willing to use the box reliably for that. Defecation was still hit or miss. For a little while, we continued working on the clicker training. And the eventual point that we reached with Boomer, with the combination of these approaches, is that if Boomer is home alone, he will go and he will use the box 100% of the time for all eliminations. If the owners are present, he will come and tell them when he needs to poop and wait for them to go down and play the clicker game. And he will go, he's like watching the whole way, like, are you coming? Are you coming? He'll enter willingly, will defecate. They're able to click and treat the entire sequence, and then he's good to go. And I said, well, do you want to work away from that? And they were like, nope. We're happy. It's kind of fun. It works for us. If it's the middle of the night, he comes out, just knocks stuff off the nightstand. I need you to wake up. I need to poop. I need to poop. I need to poop. I need to poop. Puts the house robe on. Treat. Back to bed. She's like, I don't sleep well anyway. It's fine. Okay. So we don't always set the end trajectory for what that looks like. Once you reach the point where the client is happy, assuming that we've addressed welfare and medical and all of those things, that may be a really super end point. So there's some other examples in there. I'm going to skip ahead in the interest of time. And yes, okay. So here we've got, switching gears just a little bit, as we've got about eight minutes or so left. Human-directed aggression. This is not the full aggression sequence, but it's just an example. I'll tell you more about him in just a second.
Is it pretty typical for him to kind of hang out in that position?
Yeah, for a minute until we start walking, and then he'll start getting into a back hunched.
Yeah.
When my sister came over, she came through the back door. He was out and about. Something about the front door.
Yeah. Yes, handsome. It is impressive how much those pupils change even throughout the course of just a minute or two.
Mm-hmm. Yeah, if you continued to walk, he would probably stalk you and attack.
Yeah.
From behind.
I know, handsome. And with those little kind of jumpy, startled responses, would you say that's pretty typical when he's kind of, again, in this mode?
Mm-hmm. And sometimes when he's not even, he's jumpy.
Yes.
So that's sort of a baseline for this particular cat. I'll tell you a little bit more about his history. So I was called out to evaluate him. He's not aggressive to the owner. He is aggressive to all visitors who come through the front door. He's more tolerant if they come through the back door. I don't know why. Truly don't know why. And so if someone comes through the front door, this is a very mild version of what that looks like. So the moment he hears the front door opening, he comes from wherever he is, usually gets to about there and goes through this sequence. What we did differently in this one that allowed him to disengage on his own was basically I came in and then just stood there. Very minimal interaction. So it tells me that, based on the difference in what he was doing here compared to what he does in other normal circumstances, that a lot of it is truly kind of a provoked reaction, that if there's still activity and chaos and movement, it maintains a higher level of arousal. What we were able to see, I'm going to close this door here give me 1 second. So what we were able to see within that was that just within about 60 to 90 seconds of decreased overall environmental stimulation, his arousal level started to come down, the pupils started to constrict again, and then he was able to self-disengage versus having to reinforce. So there are a couple of things. It suggested to me that at this point that if he had a way of moving away rather than forward, he might take it. So that was just a little bit of a baseline. Now, in the normal circumstance, what would happen here is if the person came in, was greeting the owner, if they started to move directly into the house while he was still in that heightened arousal state, he would come forward very offensively and has injured people. So he's very, very dangerous in that circumstance. So that was sort of where we started with him as the baseline. So, from an overall training standpoint, I'm embarrassed to say that I don't have the sequence where we actually taught him what I'm going to tell you about next. I realized that when I was putting this together. I was like, dang it, I really want that clip. But what we did with him, a couple of different things. Number one, if we needed to have people coming in and out of the house, they used the back door rather than the front, with the awareness that he might start to sensitize to the back door. So the client was cautioned about that if she started to see that, then we were going to have to manage things differently. He is able to be brought down to the basement, a very nice furnished basement, but there's a door that can be closed there. So if she needs to block access, she's able to do that for exposures, so we're not continuing to sensitize or take any safety risks. And what we started doing with him, a couple of different techniques that became very relevant. We started out with essentially a find it game. Like I do this with a lot of our dogs and for a variety of different circumstances, but it's literally just a find it and then tossing a food treat for the cat to eat. In this case, I'm grateful that he's very food motivated, which made this a whole lot easier. So we conditioned a find it sequence. Find it, treat toss, wait for him to eat it. Find it, treat toss, wait. Find it, treat toss. And we started there without any movement or without any sort of provocative stimuli. And then what we started doing from there was we were building that into what I wanted him to start to learn. Quick little sidebar. Most of the time when we're focusing on our behavior mod plans for a lot of our cases, we're not only looking at this from the standpoint of is there a particular mechanical skill that we need, or is there an incompatible behavior, or is there an emotional response that we're trying to create, but truly what is the coping skill? What is the coping response that this animal needs? What is the behavior that would be functional in this situation that would allow them to navigate the stress, the environment, the whatever, in a way that's different or better than what they're already doing? So that is sort of just a big picture perspective. And so I'm thinking, gosh, if I could teach him how to walk away from a potential threat, gosh, wouldn't that be a great skill for him? So what we started doing was we took that find it, and then we broke it down into, we had him loose during one of our follow-up sessions, and I was doing it, which is why I don't have the video clip of it. But I would walk up just to the point, so let's say he's positioned over there, I'd walk up just to the point where he alerted to me. I'm grateful that I was able to get to about 6 feet of him before that happened. So I'd walk up just to the point of alert, pause, find it, and toss it on the opposite side. So he basically started, with rehearsal, he started to understand you approaching me means we're going to play the game where I find food away from you. And so we started practicing that sequence. And it was repetition, repetition, repetition. The owner continued to work on this until they were able to approach. He would alert, take a step away, and then we could essentially mark with the find it game. So we are now creating an operant sequence of away movement in response to provocative stimuli. And it was a matter of practicing that until that became more of a rehearsed sequence for him. Any questions on this guy? Yes?
Were you actually having him find something, or were you using that as the cue for you throwing the treat and him going?
So the find it is, it was something that just came, so are we finding something, or are we basically utilizing it to hunt for the food that was tossed?
Your verbal cue to retrieve?
Yes, the verbal cue is, and it came from an exercise that we use a lot for dogs, and we can go into more details on that. But you could use any verbal cue. You could have actually just used the mark for that. You could use, treat. I'm not worried about what the words mean as much as. He's not targeting anything at all. It's purely sort of the cue that there's going to be food appearing in your environment. And what I also like about that particular exercise for a cat like this is that when we get that conditioned find it cue and the animal understands that there's going to be food on the ground, if they're focused on that thing, it also is reinforcing breaking of eye contact and orientation to the ground. So I can use it from a movement standpoint, I can use it from an eye contact standpoint, and I'm getting the classical counter conditioning piece as well, where we're changing the emotional response in the process. All with a stupid little 2-word find it, right? It's amazing. Yes?
Would find it be useful for cats that stalk, like you were talking earlier about stalking, not necessarily really aggressive, but playing stalking?
So would a find it be useful if those cats were doing more of a stalking behavior? Potentially. What we have to be really careful about when we're setting up an exercise like that, it could be, what I don't want the cat to learn is that stalking is the way to make the game happen. So we have to make sure that we're not creating a behavior chain. And that's why that threshold awareness and really getting an understanding of counter conditioning and desensitization is critical before we decide exactly what we're going to do. I'm going to wrap up with just 1 or 2 slides here, and we're going to break for lunch. Overall, what we're looking at is, for any behavior mod approach, we're using the same techniques that we use for any other species. It's not the learning theory that changes. We've got to figure out what are the reinforcers for that particular animal, which are the combination of techniques, and obviously this is not a comprehensive list. That is my boy, Cedric. He's no longer with me, but he's still in my heart. So that's my boy, Cedric. And then some of the little tips that we're thinking about for cats that I find when I'm going into a cat BMOD session: patience, short sessions, avoiding coercion or physical manipulation, decreasing distractions really, really helps. Establishing for that animal what's the reasonable number of reps, aware that they're not necessarily consuming a lot of food per meal, and that's back to normal species behavior, right? They would normally eat 8 to 10 small meals over the course of the day. They're not necessarily gorging, so we're not going to get the luxury of working with a beagle, for example, where we can just feed and feed and feed and feed and feed. Cats are going to shut off, and the actual value of the food reinforcer starts to decline over the course of a session. And it generally takes them a little bit longer to consume the food reinforcement, which is why I really like the marker training, because we can get that secondary reinforcer and we're not relying on the actual consumption of food as the conditioned, as the conditioning piece. So there's going to be other things that we can look at for that, but with that being said, it's 12:01. I do not want to keep you from lunch because that's never a positive thing for anybody. So thank you for your attention.